Good afternoon, everybody. I'm Mike McBrady, chairman of the board here at ImageTrend, and I'd like to welcome you to the 6th annual Hooley Awards here at the Connect Conference. I'd like to first kind of take a minute and try and explain what the Hooley concept is. It's a little peculiar, but we started at ImageTrend back in 2012, and within the walls of ImageTrend, it's actually a 24-hour period where I've got an idea and I'm going to take a day and I can work 24 hours straight if I want. I can cheat, start a little early. I can do what I want, but it's really exercising an idea, developing something, and just having some fun. And when I'm done, everybody in the company gathers and we watch the Hooley presentations by the hooligans that did the Hooley projects. And they're generally about 3 minutes long, and as everybody watches them, we rank them as to who did the coolest, the funniest, the best piece of engineering, the most world-changing kind of a project. And when we're all said and done, it really comes down to what was the greatest thing we saw, and we have some fun. There's been some odd projects over the years. There was one Hooley that was a design for a Frisbee golf course on the campus, a little off the beaten path, but still kind of fun project. There was one that measured the amount of beer left in a beer keg using a Raspberry Pi computer and some sonic hardware. Also a very useful project. But there's also been some really great projects that have really become part of the product and part of your everyday life that come out of it. There was the mobile fire inspection. That was originally a Hooley project done by Taylor Pence and a group. And it's made its way into the product line. It's used every day by thousands of people. Crew Care actually began as a Hooley project. And the idea was, what's the stress level of EMS crews and what can we learn about it? How can we look at what the problem is and how can we help with that problem? A great Hooley project still has presence even today. And at Hooley Connect, we've done Hooley Shorts, which are customers and attendees that wanted to pitch an idea for 3 minutes and do some things like that. And some of these shorts have been really funny, some of them have been really interesting, and some of them have been very useful. An example of that is Keith Tanner built some power tools. Keith is from Surprise, Arizona, and he's built power tools in Elite and done them as Hooley Shorts, and many of you probably use those power tools from Keith today and think it's part of the product, but it's actually a byproduct of his Hooley presentation. So Hooley is really kind of about taking some risks, offering some innovation, and just kind of, without fear of failure, taking a swing at what an idea could be. And it's really about changing the world one idea at a time. And that's kind of the science of Hooley. And in the culture of ImageTrend, Hooley is a pretty powerful thing, and it's a really good catalyst for product development. And so with that said, we're going to proceed here, and I'm going to introduce Joe Grau, who's going to tell us about the Hooley Awards this year at Connect. Thank you for your time.
Thanks, Mike. And now we celebrate and recognize our community's commitment to challenging the status quo, turning ideas into action, and taking risk to make improvements within the community and the industry as a whole. We have 3 categories that we will celebrate today, starting with innovation, which recognizes those who are serving in new or innovative ways in order to advance the needs of their organization and the communities they serve. Next, we will move to service, where we recognize users that are using data to advance their safety or community goals. And finally, to the new frontier, where we recognize those that have gone above and beyond and who are breaking new ground using technical innovation within their communities. Each of these categories are distinctly different, but equally important. We also want to thank our panel of judges and leaders within the community. AJ Heitman, Editor Emeritus of GEMS, Greg Fries, Editorial Director at Lexipol, John Eric, Senior Editor of EMS World, Eric Cheney, EMS Specialist, Office of EMS at NHTSA, and Sue Prentice, Executive Director at American Trauma Society. And now on to the Innovation Award.
Hi, I'm Toby Ritt, our Vice President of Sales. It's my great honor today to introduce the nominees for this year's Hooley Award in the Innovation category. At ImageTrend, we are always striving to move our products to the next level, challenge the existing boundaries, and to exhibit true creativity in serving our markets. This award is meant to acknowledge our customers within our community who have exhibited true creativity and innovation. The nominees in the Innovation category are Christopher Torno, Eureka Fire Protection District; Dana Cardenas, Tempe Fire; Celia Berry, Santa Cruz County. Let's learn a little bit more about each of our nominees.
Christopher Torno, Eureka Fire Protection District. Eureka Fire Protection District responds to pediatric-related incidents as 8% of their calls. Mid-year 2020, the decision was made to transition to Broslow-style pediatric bag. This switch helped cover the different sized equipment for each color group, but did not help with the different dosing of medications. To help with this, Christopher created a pediatric situation tool in Elite, building out each color age group and categories. Inside each group, he was able to list every medication EFPD carries and its concentration, and then convert the dosage to milliliters based on their specific EMS protocols. With these changes, it basically eliminated the need for providers to do dosing calculations, so they could accurately treat their patient and properly document during the incident using the timestamp feature. With the combined usage of the new bags and the pediatric situation tools, providers have relayed a decrease in stress levels during pediatric calls. Dana Cardenas, Tempe Fire Medical Rescue. Tempe Fire Medical Rescue understands that their data is key to ensure their crews are responding appropriately to support a successful EMS and community medicine program. Using ImageTrend Elite to capture all incidents, including patient encounters, Tempe Fire capitalizes on a seamless integration between their community medicine program and EMS to coordinate the best possible care for their patients. From there, Tempe Fire takes full advantage of ReportWriter to extract their data, feeding it into their own predictive analysis model to realize key associations and make predictions with the goal of reducing their non-emergent calls. By the numbers, Tempe Fire has celebrated major successes in quantifying their call reductions for stakeholders. Their rolling 6-month performance metric shows about a 49% reduction in non-emergent calls based off run forms that were completed. By focusing on the frequent utilizers of their emergency resources, Tempe Fire not only impacted their reduction in non-emergent call volume, but they also affected 25 other performance measures including response time, insurance costs, and crew availability. Celia Berry, Santa Cruz County. SAFER, for Search, Alert, File, and Reconcile, is a community-focused initiative to improve patient treatment and to integrate all related data bidirectionally with receiving hospitals. Santa Cruz County was the first agency in California to realize the goal of fully utilizing the SAFER method, and to have all aspects of it implemented and working for the California Plus EMS grant project. This project matters because their medics have already experienced responding to calls for patients who are unresponsive. Using a driver's license scanner on their iPads, the medics quickly addressed relevant patient history through the health information exchange that informed their decisions about medications and treatments. Patient medication allergies are also transmitted prior to patient arrival at the emergency departments. Even amid the challenges of a short implementation in a pandemic, Santa Cruz County was able to accomplish this in just half a year by teaming up with Shio HIE, Mark Roberts, and ImageTrend. In the words of Celia Berry, the future of medicine requires that providers are better connected in real time. We're there.
And our winner of this year's Hooley Innovation Award is Christopher Torno, Eureka Fire Protection District.
I'd like to take this opportunity to thank ImageTrend for recognizing me and the work done on the pediatric situation tools. It's an honor to have this feature highlighted.
I am Dan Vanorny, Vice President of Software Engineering here at ImageTrend, and it is once again my great honor to introduce the Service Award category at this year's Hooley Awards. The Service Award considers how data is being used to further the safety of your community or reach community goals. And it also acknowledges the fact that data is boundless and can be used in any number of ways for the benefit of society. And the top 3 nominees for this year's service category in our Hooley Awards are Tami, Kayea, Dallas Fire Rescue, Scott Perryman, Sacramento Fire, and Alex Trembley, North Memorial Health Ambulance Service. Let's learn a little bit more about each of these nominees.
Tami Kayea, Dallas Fire Rescue. Dallas Fire Rescue has implemented an expanded QA program to track recognition as well as complaint calls or reviews that showed performance, policy, or documentation issues. They use the transfers feature in ImageTrend Elite to send the information to a sub-agency where they complete the inquiry into the event. It logs any meetings or training done with Cruz by one of their EMS officers or by a medical director, and can log additional training required by the Office of Medical Direction or members on performance improvement plans. If a run is investigated by the state or internal affairs, DFR tracks that process. It allows all the QA documentation as well as any internal documentation to be digitally stored in one place and easily retrieved or reported on through Report Writer. Chief Kayea said they've never had a better grasp on what the issues are and how to address them. Accountability has improved tremendously. Scott Perryman, Sacramento Metropolitan Fire District. COVID-19 threw a curveball last year throughout the nation, and agencies had to quickly pivot. Metro Fire had already been utilizing ImageTrend Community Health and quickly modified its use to apply to COVID-19. Captain Perryman took on this challenge with grace and perseverance. He led the team to ensure COVID-19 testing was done in their community and rolled out all the necessary documentation to the mobile integrated healthcare team. His ability to pivot and be proactive in a trying time is the very example of going above and beyond his duties. Captain Perryman demonstrates an extraordinary commitment to his community as well as to the general public. Alex Trembley, North Memorial Health Ambulance Service. Alex undertook important and courageous work to quantify and better understand implicit bias in EMS workers with the goal of improving the overall health of the community. Through better describing the issue with the use of data, our industry can ideate on how to foster a more inclusive environment and be able to represent the community we serve. It also helps existing providers improve their individual practice to better care for all those in the community they serve. This topic can be threatening for some people, as these inquiries can challenge strongly held or loaded beliefs. Alex endured personal attacks and threats as a result of this work. Despite this, he was able to complete the study and identify areas for improvement and establish a baseline. This study will be important as we continue to evolve EMS to better meet social determinants of health and better serve our communities.
And the winner for this year's service category is Alex Trembley, North Memorial.
Hi, everybody. I just want to say thank you for this award, and thank you to ImageTrend for being a great partner to our organization and to a lot of EMS organizations in Minnesota and around the country, and to highlight this work on social reform in EMS. It's a big honor to be here, and thank you, especially to my project team, Dr. Sam Larson and Dr. Mike Ford at the University of Wisconsin, and then myself here at North Memorial, on Wisconsin, and go Blazers. Thanks.
Hello, I'm Michael Patock, Vice President of Strategic Development here at ImageTrend, and I am pleased to be presenting the third Hooley Award today for the New Frontier category. The New Frontier Hooley Award is to recognize organizations that are forward-thinking and blazing new trails within their industries. They are breaking new ground into uncharted territories to provide the best patient care and service to their communities in a whole new way. And to do this, it takes great leadership, vision, passion, and the willingness to take some risks in order to pioneer these initiatives. All of those attributes are aligned to our core mission as well, which is to make the world a better place through technical innovation. And I believe all of these folks have done just that. We have 3 great finalists this year, each with initiating projects that are just starting off with ideas or concepts and have achieved some truly unique and inspiring results. So without further ado, this year's finalists for the New Frontier category are Michael Wells-Whitworth, Montgomery County Hospital District, Catherine Farrokhi and Nick Ritchey, Riverside County EMS, Bryan Wells from the Los Angeles County Fire Department. Let's learn a little bit more about these finalists.
Michael Wells-Whitworth, Montgomery County Hospital District. Montgomery County Hospital District in Texas realized a need to understand and track the quality of care for patients in custody and their risk of death. Utilizing the sum total features in ImageTrend Elite worksheets, MCHD was able to create a risk score for patients in custody and their risk for death. Using existing research for qualifiers, the worksheet guides their providers down a comprehensive decision tree when treating these patients. Chief Wells-Whitworth and MCHD have embraced the ability to customize Elite for the data they need to fit their requirements and deliver outstanding patient care. Catherine Farrokhi and Nick Ritchey, Riverside County. California's Riverside County has integrated an important milestone in patient care. POLST, or Portable Medical Orders, is an approach to end-of-life planning that is valid outside the clinic or doctor's office, so all healthcare providers understand the care to provide during a medical emergency. Riverside County teamed up with the Manifest MedX HIE and ImageTrend to successfully integrate POLST orders with ImageTrend Elite, thus giving crews out in the field access to obtain POLST documents from the Care Directives POLST registry. Riverside County plans to further develop the POLST integration as part of the SAFER initiative. Bryan Wells and LA County Fire Department System Administrators, Los Angeles County Fire Department. The Los Angeles County Fire Department has already utilized ImageTrend Elite in innovative ways never seen before. Some examples include the LA County Fire Department Lifeguard System serves as a beach patrol, BLS and ALS patient care, and boat rescue. Collecting all operations flights, including non-incident operations, with the data collected also serving to track aviation-related fields such as Hobbs times, tack times, water drops, and rescue hoists. Implementing the use of the inspections module for wildland fire prevention, modifying the traditional role of the inspections module to capture brush clearance requirements. Within just a year's time, LA County Fire Department has pushed past the traditional roles of Elite, taking the product in groundbreaking ways.
And the winner is of the New Frontier Hooley Award, Michael Wells-Whitworth, Montgomery County Hospital District.
Thank you very much. I'm very honored to accept this award on behalf of myself and MCHD. I want to express my appreciation for for the researchers who developed the subject and custody risk assessment score, as well as the entire team here at MCHD who have worked so tirelessly to implement ImageTrend and add it into our system. Thank you very much, and we look forward to doing many more creative and exciting things with ImageTrend.
Congratulations again to everyone. Wow, we had some amazing, thoughtful, innovative ideas that no doubt are going to change the way we all operate for the better. Thank you so much, and congratulations again to the Hooley Award winners, the finalists, and all of the nominees that work so tirelessly to move these initiatives forward. We look forward to next year and the future with all of you. Thanks again, and take care.